Okay. All right. Good afternoon, everyone, and welcome to the information session on Medicaid health plan changes. Our session today is being co-hosted by the Pennsylvania Health Law Project and the Pennsylvania Health Access Network. And we have so many people joining us today. We're delighted to see the turnout that we've received, and we're glad that you're here with us to learn some important information. We have an excellent panel of experts here today to discuss the upcoming changes to the Medicaid health plans available in Pennsylvania, and I will be introducing those panelists in just a moment. Before we get started, I'd like to go over some brief housekeeping notes to make sure that our session runs as smoothly as possible today. So first, please remain on mute when you're not speaking. I will do my best to keep an eye on attendees' microphones and make sure that everyone who needs to be muted is muted. Live captioning is available for today's session. The icon to enable the captions is in your control panel at the bottom of the Zoom screen. And you just click the icon that says CC live transcript and then click enable live transcription. Today's session is being recorded and will be posted to the Pennsylvania Health Law Project's YouTube channel tomorrow. Today's information session is going to include a round of questions, which I'm going to be asking the panelists. And then as time permits at the end, we will take questions from the audience. Questions for the panelists can be submitted throughout the webinar using the Q&A function in your Zoom panel. Please do not submit questions through the chat, as with the amount of attendees that we have today, the chat will definitely get flooded and the questions could be missed. And lastly, we will get to as many questions as we can today, but we want to honor everyone's time and we're remaining committed to stopping by 3:30 today. So if there are unanswered questions that we don't get to, please reach out to PA Enrollment Services and their phone number will be on one of the final slides. So with that, I will introduce our panelists for today. We have Barry Bowman, Operations Chief and Director of Compliance with the Department of Human Services, Office of Medical Assistance Programs. We have Lori Rock, Senior Healthcare Analyst with the Department of Human Services, Office of Medical Assistance Programs. Kyle Fisher, Managing Attorney with the Pennsylvania Health Law Project. Jesse Foster, Deputy Director of Policy and Partnerships with the Pennsylvania Health Access Network. Terry McDonald, Outreach Operations Manager with PA Enrollment Services. And finally, we have Laura McMurray, the PA EAP Project Manager with PA Enrollment Services. So before we dive into the meat of today, I wanted to do a very quick poll with the audience. I'm going to launch it right now. I'd like you to just tell us what your role is here today so that we can get an idea of who we have on the call. And if you don't fit into any of these categories, you can select the other option and then please type your role into the chat, just so that we can hear who we have, just so we can see who we have on today. So it looks like we have a good deal of consumers who are on Medicaid or a parent of a child on Medicaid. We have healthcare providers and we have advocates, and it's sort of split. So that's a good mix of people. All right, I'm going to go ahead and end that poll. And we're going to go ahead and get started with the questions. So my first question, I'm going to stop sharing my screen so we can see everyone. My first question is for PA Enrollment Services, so Laura or Terry. Can you tell us what exactly is happening on September 1st?
Yeah, sure, definitely. So September 1st is the effective date for the new physical health plan changes. And also what that means is anyone who has a plan that will be discontinued as of the 31st of August, they will need to make a plan selection by August 16th, and their new plan would be effective September 1st. So there's a lot happening, and I'm not sure if DHS wanted to add anything as well regarding that September 1 date.
Well, perhaps for DHS, we could ask if you could give a little context about why this change is happening.
Sure. This is Lori Rock. This change is happening because we did a competitive procurement process called a request for application, and we got bids from a lot of different managed care plans, and we selected plans were selected and awarded agreements, which are like contracts. And so what you're seeing now is us implementing the results of those choices.
And then next question is for PHAN. So Jesse, does everyone need to change plans?
Most people actually aren't going to be directly affected. It's only anyone who has Aetna in any part of the state, and also folks who are in United Healthcare plans in the Lehigh Capital area or the Southwest, and folks who have Medicaid through Highmark, previously known as Gateway in the Northwest. We'll have maps up later, but definitely, especially Aetna, all of Aetna is no longer going to be covered across the state. But for folks who have other plans, unless you want to voluntarily change plans, you won't have to take any action.
Fine, thank you. And question for DHS. So does this change impact all the Medicaid managed care plans and the children's health insurance program plans and the community health choices plans, or is it just a subsection? Can you talk about that?
Sure. I want to go back to the last question and just add that people who don't need to make a selection, everyone across the state, they do have other choices available to them for different plans that were not available previously. So to the question you just asked, this implementation only affects the physical health managed care system. It does not impact the community health choices plans. It also does not impact the CHIP plans, nor does it impact any dual eligibles who might have a special needs plan. So it's just strictly the health choices physical health plans, which are up on the slide that you see.
Great, thank you. And for the folks from Enrollment Services, I think it was said already, but for those people who do need to change plans because theirs is going away, what's the deadline to do that?
It is Tuesday, August 16th.
Mm-hmm.
Okay, great. And what happens if someone...
Dana, I'm sorry, Dana, can I just add something to that? Because I know we're talking about, changes that need to be made, and that August 16th, the 16th date is coming up pretty quickly. Right. And I did see already someone had posted something in the chat, but there were mailers that went out to those households where someone does need to make a plan change, as well as mailers notifying the other consumers that may not be impacted, but informational self-mailers went out as well. So I just wanted to stress that mailers and calls are being made to consumers and to households so that they're aware of what's happening and also of the deadline.
Okay. And a follow-up question for you, Laura, then what happens if someone who is impacted, in other words, needs to make a change, does not do so by August 16th?
Right. So if someone does not make a change, they will be auto-assigned into a plan, and that will happen at the state level. That's not something that we're doing at Enrollment Services. And then if they find that they're in a plan that they would still like to change, they can do that after their effective date. So they're still able to change their plan as well. But They will have coverage and they will be enrolled into a health plan.
Okay, great. My next question is geared towards Kyle from the Health Law Project. I was wondering if you can go through for us the major plan changes that folks should know about. And if you can do that zone by zone, we'll start with the Lehigh Capital Region.
You could just go back one slide first, and I want to talk about a few changes that I think apply statewide here. So I think important to note with this change to the physical health choices programs, for the first time, Pennsylvania is going to have 4 managed care plans operating statewide. So of the plans that we see here, UPMC for You, Amira Health, Caritas, and Keystone First, which are essentially the same MCO but branded differently in different parts of the state. Health Partners plans and Geisinger are all going to be operating statewide, and we haven't had that before. So it's definitely a big change. It's going to start on September 1st. Also important to note that for me, at least as a Medicaid advocate, this is exciting because these have all been high performing plans. So they have done really well in terms of consumer satisfaction. They've done well on healthcare outcomes or effectiveness, the HEDIS surveys historically. So these are MCOs that have been high quality historically, and now they're going to be operating statewide. I think one sort of big question mark is whether they're going to be able to replicate the success they've had in sort of more narrow geographic regions, regionally, statewide. So once they expand their footprints, are they going to be as successful in terms of attracting membership, and then also in terms of having consumer satisfaction and stronger healthcare outcomes in other parts of the state, not just the areas where they operate now. On the flip side, going back to apart from plans that are expanding their footprints, we have MCOs that are either exiting the state or shrinking their footprints. And that's where you see here in the Lehigh Cap zone, Aetna and United are both leaving. And I should say, Aetna is no longer going to be operating a Medicaid product in Pennsylvania. So Aetna is leaving the physical health choices program entirely. United and Highmark Whole Care, formerly known as Gateway, are shrinking. So in Lehigh Cap, you see these 2 plans are leaving. And so you see about 1 in 4 health choices consumers in Lehigh Cap will need to make a change or be auto-assigned. Northwest zone, it's the same. About 1 in 4 consumers will need to make a change. Aetna and Highmark are leaving that zone. In the Southwest, it's Aetna and United exiting, and it's about 1 in 5 enrollees who will need to make a change. In the Northeast, it's only Aetna leaving, and it's about 1 in 7 enrollees who will need to make a change. In the Southeast, it's only Aetna leaving, and again, 1 in 10 enrollees who will need to make a change.
Great. Thank you, Kyle. And Jesse, a question for you. Can you walk through how individuals can change their plans?
Absolutely. So people have a couple of different options. The first that we see on the page here is you can go to enrollnow.net and you'll enter your name, date of birth, and then they'll ask you for either your recipient ID number that's on your insurance card, or you can use the last 4 digits of your social security number to access the website. And then once you're in, you'll be able to make those changes to choose a different plan based on the area you live in, and also you can choose a different provider. You can also go to the App Store if you prefer online and download the PA Enrollment Services mobile app. You can also call into their phone number. It's on the screen, but I'll read it out loud. It's 1-800-440-3989. They are available Monday through Friday from 8 a.m. to 6 p.m. And last but not least, you can also respond by mail with the mailer that was sent out in the postal mail. So those are the different ways that you can make sure that that information gets to the PA Enrollment Services.
Great. And this is actually, I'm going through the questions in the Q&A panel, and this will touch on one of them. This goes for DHS folks. Can people change their plan at any time? So if they happen to choose a plan or they get auto-enrolled into a plan that they don't like?
Yes, in Pennsylvania, consumers have the option to change their plan really at any time for any reason, and you would still go through the same contacts for PA Enrollment Services to do that.
Great. Question for PA Enrollment Services. When will a new plan change that's made after the initial August 16th deadline go into effect? So like what happens if somebody makes their plan selection on August 17th? When will that go into effect?
Hi, Dana. So once a plan transfer is completed, it doesn't start right away. So depending when that change is made, it could take 4 to 6 weeks for a new plan to begin. So when we look at the current timing rules for plan changes, any changes made between August 16th and September 8th would start on 10/1. And any plan changes that are made September 9th through October 13th would start 11/1 or November 1st.
Great.
Yeah, and sorry, Dana, and I do want to stress too, once a new plan change is made, the individual will continue to use their current health plan coverage until their new plan begins.
Great. Thank you for that. And Jesse from PHAN, what kinds of things should someone consider when they're switching their plan?
The thing is really going to be about what providers you see. If you're currently seeing different doctors, and especially if you have a multitude of different doctors that you see, if you have a primary care and different specialists, they might be all in one plan, but they might not. So you might want to check with your doctors what options they are enrolled with. If they're all in the same plan, that might make your selection a little bit easier. But if for any reason, let's say you have a primary care doctor that only accepts Keystone and your specialists will accept Health Partners and a few other plans, but they won't accept Keystone, you're going to have to make some choices. And so it's really important to make sure that you're prioritizing. One thing to know, if you have multiple family members who are going to be affected, you don't all have to choose the same plan. So you could definitely say, maybe for myself, one plan is a good choice, but maybe for another member, my spouse or my children, a different plan might be a better selection. So those are a couple of things to keep in mind.
Thank you. Kind of going off of that theme, this question is for the folks from PA Enrollment Services. How does somebody find out which doctors and other providers are in each plan's network? And second to that, is the process the same for someone seeking multiple doctors and other providers?
Sure, I can take that one. So so individuals can check their doctors, providers on the Pennsylvania Enrollment Services website. So they can do a PCP search on enrollnow.net, which was something that Jesse had just mentioned. They can also use the mobile app, the PA Enrollment Services. And of course, they can always give us a call at 1-800-440-3989. And the process would be the same if they're looking up one provider or multiple providers. If they have multiple providers, it may be easier to call, the toll-free number, and we can look them up and let them know what plans are available to them.
Great, thank you. I did want to pause because I'm noticing some questions in the chat about the slides, and I will make sure to send a copy of these slides around to folks so that they can see the maps that we went through. I realized we went through those pretty quickly, but we will circulate those again, or I will circulate the PowerPoint slides after the session. Next question is for Kyle at the Health Law Project. What happens if someone's doctor is not in the network of their new plan? Can they continue seeing that doctor?
Yes, in general, a person can continue seeing that doctor, even though the provider is not in the network of the receiving plan, with three caveats, really. So under the continuity of care protections in place, the provider would still have to be willing. The consumer would need to be in an ongoing course of treatment, and the ability to continue seeing that person is going to be temporary. So those are the three caveats, and I'll unpack them sort of in turn a little. That the provider has to be willing. So the continuity protections go to the obligation on the managed care plan to pay claims. So if I'm going to a doctor who is not in network with my new managed care plan, that the plan is required to pay those claims doesn't mean that doctor is necessarily willing to submit the paperwork or go through whatever sort of red tape process is required to submit that claim, right? They're already by definition not in network. And we often encounter clients whose providers aren't willing to jump through whatever hoops are there to work on a non-par basis with a new plan. The ongoing course of treatment caveat is broadly defined in the Health Choices Agreement. So someone who has any scheduled appointment coming up is going to be in an ongoing course of treatment, or someone who's getting follow-up care to treatment they have already received in the past 12 months. So again, broadly defined, that's less likely to be a barrier. The third piece is that this continuity right is temporary. So it's generally going to be limited to 60 days, 2 months, although there are exceptions for children in an ongoing course of treatment and exceptions for pregnant women seeing an OBGYN. So in that latter case, the continuity right continues through the postpartum period. During those 60 days, or at the end of the 60 days, almost think of it as a buffer period. So it's a time period to work out for a consumer. Am I going to stay with this doctor and do I need to change my plans? Or am I going to stick with this new managed care plan? Do I need to change the doctor? My current doctor can also go through potentially the enrollment process to become participating with the new plan, or in some cases, they can work out a single case agreement. So if the doctor wants to say, I'm not going to be taking patients generally with this new managed care plan, but I'll continue seeing you, Dana, and only you, that you're the single case. So those are some things to think through. All of these protections sort of stem from state law, but they're also in a bulletin that the plans are well aware of. But as a general question, yes, with caveats.
Okay, and Kyle, we're seeing some questions about this in the question and answer panel. So I wonder if you can answer what happens, what's the process if somebody has a prior authorization for services, like let's say it's nursing or something like that, and they switch plans, what happens then?
It's actually a nice segue to the next question. I think that was the exact next question we had lined up here. So continuity of care applies there as well. It just applies slightly differently. So it's continuity of services rather than continuity of providers. So you still have the question of whether, say, the home health agency through which you're getting the nursing services is in network with that plan. But on just the service piece, so you have a prior auth. Distinguish between children and adults, because that's where sort of there's a line drawn. For continuity of services here, for children, the receiving managed care plan has to honor the prior authorized or the prior authorization until the end of that auth period, right? So if it goes for another 3 months or 4 months, the receiving plan should continue providing those services for the full duration. For adults, the receiving managed care plan has to continue the prior authorized service or course of treatment for up to 60 days or until they've done their own concurrent review. So basically, those authorized nursing services should not stop. They should continue after my transfer to the new plan. But if an adult, the plan can do its own concurrent reviews with prior auth, the services are already in place and stop them. Or at a minimum, it has to continue them for 60 days. If I'm a child, it has to continue them through the end of the authorization period.
Great. Thank you, Kyle. I know a lot of people are concerned about that in the Q&A box. Question for DHS. This kind of segues off of something we already talked about, but for plan selections that are made after August 16th, can somebody ask for an expedited enrollment to be effective on September 1st? If, let's say, they have a scheduled surgery or some other clinical reason that they need it to happen faster?
Yes, they can. Those are situational specific. So if folks have a situation where they're in a serious clinical treatment, or again, if a surgery has been pre-scheduled and they're concerned about that, and they've had discussions with the provider and it's presenting a barrier to those services being provided, they can request to have an expedited enrollment into another MCO done. They can make that request through the Enrollment Assistance program, as well as through their MCO, either one of those entities, and then that will be submitted to the DHS staff, who look at those and make determinations on, depending on the specific issues in each case.
So in that case, Barry, someone who has a surgery scheduled, when they call Enrollment Services, they should at that point notify them of the surgery and say, I need this to be expedited to September 1st.
Correct. If they know that up front, yes, that would be a good time to do that. The sooner we know that, the better. It often alleviates situations where maybe folks who have been in an MCO for a few days within September and received other services, maybe went to the pharmacy or whatever and had those claims paid. The sooner we know, the less chance there is that then the MCOs would have to go back and recover payments from providers and things like that often happen with these. So yes, if they're aware of that up front, better to let folks know then. Yep.
Okay. Thank you. I'm going to turn to Jesse from PHAN. Is there anything else generally that folks can be doing in the meantime while this transition is occurring? I know the public health emergency is still going on, but what are some things folks can be thinking about otherwise in the meantime?
The biggest thing I would say is just making sure that you have all your contact and especially your address information up to date. If you haven't received anything in the mail, especially if you might have moved or if you've had any other changes in the last 2 years, 2+ years since the pandemic began, you can either call to the state helpline number to make sure that your contact information is up to date. For the statewide number, that is 877-395-8930. Or if you live in Philadelphia, that's going to be 215-560-7226. You can also update online via the My Compass app, or you can reach out to us for assistance.
Okay, great. And just to be clear, those numbers that you read off, maybe can you say them one more time? And just to be clear, that's for address changes and case changes, not plan changes.
No, yeah, correct. This is to contact Department of Human Services, the county assistance offices, and update just your address information. That statewide number is 877-395-8930. And for Philadelphia, it's 215-560-7226.
Great, thank you, Jesse. I'm going to share my screen again, just briefly to show the contact information for the folks we have on the line. And I just want to go one by one through each of you. For the PA Enrollment Services folks, is it appropriate for folks to call you with further questions that they might have about this enrollment situation?
Yes, absolutely.
Okay. And then PHAN, I know you have a helpline. We've listed it here on the slide. What kinds of problems can folks call you with?
If folks have general questions or they just need a little bit of assistance in understanding what the changes are, our helpline staff can help, or also to help you update the information. And we can receive messages either calling or by text or by WhatsApp.
Wonderful. And Kyle, for the Health Thought Project, what kinds of questions might somebody call the helpline that's listed here on the slide with?
So our focus is really more on access to services. So unlike the Enrollment Services entity, unlike PHAN, we're not going to be able to help folks with enrolling in managed care plans or choosing a plan. But if individuals are denied a service prior to transferring, or certainly after they've transferred into a plan, whether it's related to continuity or otherwise, even if it's a new request for prior authorization, certainly contact us via email or via the 800 number, our helpline you see there.
Great, thank you. I'm going to turn now to the audience questions, and we have quite a few of them. So we're going to use the remainder of our time to go through these questions. So the first one I'll direct towards the folks from DHS. Are there any plans that will allow you to seek treatment outside of Pennsylvania?
Yeah, so each of the plans may have providers that are outside of the state, especially when you live in counties that border like Ohio, West Virginia, New Jersey. So those providers would be included on the network information that you can access on the PA enrollment website.
Right.
So you would have to check there and see if the specific provider you're interested in is available.
Okay.
And generally, obtaining care out of state, if they're not a network provider, that is something you'll have to go to your MCO and request. That's normally done what they call a program exception to allow somebody to see an out-of-network, and as particularly if it's an out-of-state provider, because there are concerns if that provider is not enrolled in Pennsylvania medical assistance, and in many cases, not all providers, even along the contiguous states that border Pennsylvania, are not necessarily always enrolled in Pennsylvania medical assistance. So should folks have that concern and they want to investigate that, they should approach their MCO prior to actually going and seeing that provider.
Okay. The next question I will also direct towards DHS. This comes from a provider. It says, what do patients do who live in Montgomery County with United Medicaid, but the county where their primary care physician is located, in this case, Berks County, will no longer have that plan? Would they need to change plans to remain with their current primary care physician? Parents with United Medicaid secondary insurance are being told by member services that they can still come to our practice.
So if I'm understanding this question correctly, this individual wants to stay with United Healthcare, but the PCP is located in Berks County. So as long as that PCP continues to remain in network with United, there should be no issues there. The county designations are related to where a consumer lives. That determines what health plans they have to choose from. But all of our health plans generally have provider networks that extend beyond the counties in the zone in which they operate.
Okay, thank you. Next question I'll direct towards PA Enrollment Services. This person says, maybe I missed it, but what happens if you did not get a mailer?
Yeah, and my response would be to use our website, the enrollnow.net website, or the mobile app, or call us, and we would be able to let you know if you're impacted or anyone in your household is impacted. And if a change needs to be made, then we'd be able to do it at that time.
Great. I'm going to follow up with another question for Enrollment Services. For families whose primary language is not English, what method would be best for them to view this information and to change their enrollment?
Our website and mobile app is available in English and Spanish. And through the toll-free number, we service all languages. So, if they prefer to call, then that's fine. We have a language line available to assist our callers as well.
Okay. One more for you, Enrollment Services. The question is, will the enrollnow.net website tell someone if they need to change their plan?
It will show them information as far as what plan they currently have. So, but it will not specifically sort of call out that they need to change their plan. Again, so if they're on the website and they're not sure, the best thing to do would be to contact the call center.
Okay. I think the next question is probably best for the DHS folks. This person asks, is there a plan that covers all of Pennsylvania as far as having a special needs child and seeing hospitals all over the state?
Yeah, so four of the MCOs who will be going live on September 1st now operate throughout the entire state. And they make their networks available where folks want to receive treatment. So for example, UPMC for You is obviously a well-known plan in the Southwest, maybe not as well-known in the Southeast or the Northeast, but they are going to be statewide. So if you wanted to choose that plan, and perhaps you choose it and you want to use one of UPMC's in-network providers, one of their specialty providers in the Southwest area or some other area of the state, they allow that. And the same goes for the other 4 MCOs that will be statewide. So the Amira Health Caritas / Keystone plans do the same thing, as will Geisinger and Health Partners.
Okay, just for clarity, can you say which 4 plans are now going to be statewide?
Yeah, this was covered on a slide. So I believe if you provide the slides later, but Geisinger Health Plan, UPMC for You Health Plan, Amira Health Caritas, and Keystone First, which are really one health plan, but they have different product names. And Health Partners plans will all be operating Commonwealth-wide in all 5 of the zones that comprise Health Choices Physical Health.
Thank you, Barry. That's helpful. This is a physician change logistics question for PA Enrollment Services. And I'm sorry, I just lost the question. Let me scroll back up to it. If I'm changing to a new primary care physician, do I need to already know the identity of that primary care physician?
No, you do not. If you call us at our call center, we are more than happy to help you, and we can do a primary care provider search for you within a certain mile radius. But certainly if you know of a doctor or somebody recommends a doctor to you, we can look them up as well for you.
Okay. Next question is, my daughter is covered because of her special needs and she has United Healthcare Community Plan. Kyle, I'm going to direct this question to you. She has United Healthcare Community Plan. So we should be able to make no change right now. Am I understanding that correctly?
Depends on where you live, depends on the zone you're in. If you're in the Southeastern zone, United operates there and it's going to continue to operate there. If you are elsewhere in the state, and I believe I'll defer to Barry, Lori, or others on the call, that United is also currently in
Lehigh Capital in Southwest.
In the Southwest. So if you're in either of those zones and you're using United's Medicaid plan, you will either need to make an active selection of a new plan or you'll be auto-assigned.
Okay, thank you, Kyle. This is a question I think best for DHS. What happens if a patient is in the hospital when the plan changes during the hospitalization? Who is responsible for the payment?
So we have behind the scenes, we have something called recipient coverage requirements for the MCOs. Generally, the responsibility for an inpatient, if somebody went in on, say they're in Aetna and they go in prior to September 1st, normally that stay is covered by the plan that they had upon admission. So it isn't going to turn into you get in there and then I'll pay for like half of it. That it doesn't necessarily work like that. So moving forward, then if they're in a plan after the September 1st and there's an admission and maybe a plan change, then there's various scenarios that could fall under. But generally, the plan upon admission is responsible for inpatient admission.
Okay, thank you. That's very helpful. Kyle, I'll direct this question to you. It's about medications, specifically diabetes medications, but maybe you can answer generally about medications and how you find out what's covered. So it says, is there a plan that covers more of the diabetes medications?
In general, I think the answer is no. So the plans are all using a statewide preferred drug list, or PDL. And so the criteria for these medications and the meds that are on the PDL as preferred or non-preferred are all standard across the MCOs, and the managed care plans all sit on that sort of the body that's determining those meds. So there should not be any difference there. I think for a very narrow subset of medications that are not on the PDL, the managed care plans do have a bit more latitude in selecting what to put on their formularies. But in general, they're going to be the same across plans.
Okay. And Kyle, this is a follow-up question to your explanation about the continuity of prior authorized services after switching plans. Is a child defined as under 18 or under 21?
Ooh, good question. I believe it's under the age of 21, but I'll defer to the department staff. Is that right?
Yes, correct. Children under Medicaid are defined as under 21.
Okay. All right, I'm just going through. We have a lot of questions. This person asks, if a patient has rental equipment and switches to an MCO that the durable medical equipment provider is not enrolled in, will the new plan reimburse the non-contracted supplier until the equipment can be replaced by an in-network supplier? I think that could be a question for DHS or PHLP.
I'll start and defer to the department for any needed corrections, but I think it should, right? Under the continuity rules, up to 60 days, subject to those caveats I mentioned before, right? So clearly there's an ongoing course of treatment. Clearly it's going to be temporary, but the old provider has to be willing to bill the new plan, and then it is going to be temporary. So they'll need to make arrangements to either become in network with that new plan or find a new in-network DME supplier.
That's correct.
Great. A question for Enrollment Services. Can consumers choose a new Health Choices plan without selecting a primary care physician? And if they are auto-assigned to a health plan because they failed to make a choice by August 16th, are they also assigned a primary care physician? And the final part of that question, which I can read over again for you as you answer, is how does a consumer learn about the new primary care physician assignment and the contact information for that primary care physician?
So yes, to the first question. So they can, if they're changing plans, they can make their plan transfer without a PCP. If they are auto-assigned to a health plan, that health plan will handle the PCP assignment. And I don't necessarily want to get into that because that's on the MCO side. And then the consumers would receive a welcome packet from their MCO, and that would include their plan card with their PCP. So if they have the plan that they want and they have a PCP that they would like to change, they're going to call member services with that health plan to change or update their PCP.
Yeah, that's an important point. Even if folks say they maybe weren't paying attention and get auto assigned to a plan, and then they subsequently get a package from their new MCO and it indicates you've been assigned this PCP because you didn't come to us with a PCP selection. PCPs are also something folks can change at any time. All they need to do is contact that plan, and the plan can either help them find a PCP depending on what their needs are, or all the plans also have online directories. They have print directories they'll send you if that's what you want, and you can select a PCP then from those. So you can change your PCP at any time with any of our MCOs.
Okay. A few questions have come in, Kyle. I'll direct these towards you. Wondering if all of this also pertains to someone who is on MAUD, medical assistance for workers with disabilities.
Most likely, yes. Right. So it's the MAUD recipients. It's one category of Medicaid eligibility. Someone receiving medical assistance for workers with disabilities could be a dual eligible, have Medicare as well, in which case they would not be in the health choices system where we're seeing these changes. They'd be in community health choices. But I suspect the majority, if not the vast majority of MAUD recipients do not have Medicare. So they're in the physical health choices program, and they are subject to these changes. But depending on the MCO they're enrolled in, they might have to make a choice, or if they don't have to, they will have the option of new plan choices available.
Okay. I will direct this question towards DHS. There's some concern in the Q&As that I'm seeing repeated about gap in coverage for supplies. So the question is, if your child with disabilities is currently receiving monthly pull-ups and you need to select a new plan, do you have to get that all set up again? Will that result in a gap of having incontinence supplies?
Your gaining MCO will cover, through continuity of care, the authorization that you have in place. Now, as your new MCO, they will then be able to reassess any sort of services you have that are prior authorized. So as that authorization wears out, say you're authorized for those pull-ups for whatever they might do them for, 3 months at a time or 6 months at a time. Whenever that authorization reaches its end and it's time to do a normal recertification, then at that point, they can, if it was, say, an out-of-network provider, they can direct you in network or continue the relationship. Maybe there may be instances where the MCOs might want to continue the relationship with the provider that was providing those supplies.
And this is Lori. I just want to add a little to that. The department is receiving open prior authorizations from plans that are exiting a zone or the state, and we will be reshuffling that information and sending it back out to the plans where the members are moving to. So your new plan will have information about services for you that have been prior authorized.
It's probably a good time to mention this because there's a lot of questions about folks with special needs and who are receiving services and things. It's always a good idea after you select your plan and you get to the implementation date, which is September 1st, contact your new MCO and indicate you would like to speak with the case management or the special needs division. And either one of those will get to the other one if that's necessary, but maybe you want to ask for the special needs division. And then they will put you on with a case manager who can help walk you through the various concerns you might have with providers you're utilizing, services you're getting, that sort of thing. It would be a good idea to identify yourself to them so they're aware. Yes, we will be giving them authorization data, but if you have concerns, it would be a good thing to outreach to your gaining MCO and speak with the special needs division.
And Dana, just to add to that, oh, I'm sorry. Just to add to that, I noticed one of the questions someone had asked if every managed care organization or a health plan has a special needs unit, just to kind of add to what Barry was saying. And that answer is yes, they do.
And a related point, how quickly should folks have new member ID cards or those welcome packets from their managed care plan? How far before September 1st should they have that information?
So the MCOs will be getting the files for the incoming folks in late August, and they'll start doing their mailings at that time. They could be getting a substantial number of folks. So as the mailings go out, I would expect some folks might get those materials very close to September 1st, and then throughout the next perhaps couple of weeks, depending as they work through the population that they gained. If you know what plan you selected, you can contact them at any time, regardless if you got your new materials. They'll be able to identify you through your normal, personal identification numbers and things like that. So you can always outreach to your new MCO.
This is a good segue for this person's question, and it could go to really PHLP. It could go to anyone, so I'm going to leave it open. How do we get in touch with Amira Health? I used the phone number provided and it says you need a member ID and I'm not currently a member. I've reviewed the member booklet online, but I have follow-up questions. So what should that person do?
So let me clarify. This person is not currently a member of Amira Health, but they would like to speak with Amira Health.
It sounds as though they would like to speak with Amira Health. They're not currently a member, and probably because they have questions about whether they should switch into Amira Health.
Yeah, generally, when folks are either gaining eligibility or they're in a position like this where they need to change MCOs, because of the way we do independent enrollment counseling, we don't like to have folks contacting the MCOs necessarily. So I would suggest this person outreach to the Enrollment Assistance program that's been identified here. They can potentially address a lot of the questions this person might have. And if not, then we may be able to work something out. But prior to folks becoming a member with an MCO, the department really wants folks to work through the Enrollment Assistance program.
Okay. And that's PA Enrollment Services that we're talking about.
Correct.
Okay, I think this could be a question. Oh, sorry, go ahead, Barry.
Generally, we have a lot of the Enrollment Assistance program also has a lot of information about the MCOs on their website. So if folks have the capability to access the website, there is a lot of information about the plans on there as well. Laura, you might be able to run down a list of it, but it's pretty considerable. You can get network information, you can do a comparison for the various benefits, that sort of thing. So that's always a good location to do sort of background research without having to speak to the MCOs.
Right, I agree, Barry. So if they're on the enrollnow.net website and they check under program resources, they will be able to find the comparison chart for the health plan. And like Barry was mentioning, it will talk about the copays, special or extra benefits that the plan offers. So that would be a good resource as well.
And this question, I think, could be for DHS or Enrollment Services. How do you find out what coverage each plan has for durable medical equipment items like prosthetics?
Okay, so all medical assistance benefits that fall under the benefit package that somebody have are covered equally across all of our MCOs. So any medical assistance covered benefit, the MCOs have to cover. Now, specifically, once you become a member of an MCO, if you have concerns about maybe a product type that you're used to using or something like that, again, I would approach the MCO, and then their case management or their utilization folks can usually help you in terms of identifying either a new provider that might carry that brand or any other sort of concerns you might have. But the benefits themselves are that as long as it's covered under medical assistance, all the MCOs have to cover.
Okay, this is somewhat of a follow-up question, and maybe you'll reiterate what you just said, but how will the services change with the new plan that you have?
Medical assistance services don't change. The medical assistance benefit package for the various folks in Pennsylvania, whether the adult or the children's benefit package, have to be covered by all of the MCOs. Now, some of the MCOs may differ in some things that they may offer to their members. Some of them may offer potentially a membership at a YMCA in your zone or something like that as an add-on benefit. And that's also, a lot of those things can be found on the enrollment website as well. But in terms of medical assistance benefits, they're all going to stay the same, your MCO, but where it differs is they might be providing that benefit through a provider that you had with another MCO that might not be in your network. So you may need to change a provider, or maybe consider, or they may use their providers may use a different product that's of the same category.
Okay.
Again, once you become a member of an MCO, and you have sort of you have services that you're receiving, you're concerned about, it's always a good thing to touch base with that MCO and discuss those matters, because they have a lot of staff there that can help folks sort of navigate, which providers are best for them, and which may be closer to them. Certain DME companies, do different kind of dropping, mailing and all that good stuff. So always good to touch base with your MCO. Mm-hmm.
Thank you.
Add into that one, Dana.
Sure.
Just to build off what Barry mentioned, I think some of the plans do have different optional or add-on benefits. So there might be something like eyeglasses for adults or additional dental benefits. So the chart that Laura mentioned on the Enrollment Services website details some of that, but oftentimes it's sort of generally stated. So they could reach out to Enrollment Services to see if they have any more details about the precise parameters of that dental benefit for adults or the additional dental benefit. With reference to the specific item mentioned, prosthetics, certainly second Barry's statement that the plans all have the same sort of benefit package, sort of coverage parameters writ large. I think sometimes we do see different proprietary coverage criteria for a particular type of service. So in addition to Barry's suggestion, I would also suggest talking to the DME supplier about how they interface with the various managed care plans to see if they have any suggestions on one versus another.
Thank you, Kyle and Barry. Next question is again DHS. We have had a difficult time in the past with providers accepting Medicaid in general, especially mental health providers. Has there been any extra expansion of providers accepting Medicaid with these new plans?
So, I'm sorry, Lori.
Go ahead, Barry. You're on a roll.
Yeah, unfortunately, this is physical health choices, and I know this is confusing for folks because we use the same title for all of the Medicaid managed care delivery systems in Pennsylvania. So behavioral health services, mental health services, and substance use disorder services are provided through behavioral health MCOs. So when you become eligible, you get assigned both a behavioral health MCO as well as a physical health MCO. So these MCOs that we're speaking about today would not be responsible to have networks of mental health providers. That would be the behavioral health MCO that you're enrolled in. This change is not affecting any of the behavioral health MCOs. So if you are unsure who your behavioral health MCO is, I would suggest contacting perhaps your CAO, or there's other, Laura, I'm not even sure. Are you guys able to access folks and identify the BHMCOs for them?
Yeah, if someone does call, we are able to provide them with that information.
Yeah, and then they would be, the BHMCO would then be able to address, and we all know there's a shortage of mental health providers sort of nationally, and it can be a particular problem in Medicaid. So it would be, in a situation like that, you really should contact your behavioral health MCO. Now, in terms of the networks that the MCOs are offering, the MCOs who have remained in the zones, their networks will remain the same. We call them the legacy MCOs who are in a zone. They're not going anywhere. They stayed. Their networks have remained the same. They're always looking to bulk up their network, so there could be some additions. The incoming MCOs have what we determined to be acceptable networks. They'll probably be growing over the first year as more providers sort of become familiar with them and they bring some additional providers in them, but they all have what are adequate networks. And if you encounter any access problems, it's always good to go to your MCO. In some cases, when folks approach a provider directly, sometimes the office staff does not necessarily, office staff changes in provider's office. Sometimes they'll tell folks they don't take a plan, and really they do, and all those sort of things that can happen when you're talking to providers. So if you run into a situation like that, it is always good to check back with your MCO, explain, I'm having a difficulty with this provider type, I would like assistance with this, and then they can look into the matter depending on what provider type it is. But for mental health providers, they wouldn't necessarily be covered under these benefits that we're talking about today, which are physical health in Pennsylvania. Pennsylvania is kind of we do business maybe differently than some other states do. Some other states might have a plan that covers all of your healthcare needs. In Pennsylvania, we bifurcate the physical health side with behavioral health side, so folks have both a behavioral health MCO and a physical health MCO.
Barry, a follow-up came in as you were answering that question regarding the expansion of providers accepting Medicaid. I was referring to physical health also. So the question originally was whether the physical health networks will be expanded at all with these changes.
It really depends, I think, on the provider type you might be speaking about. I don't think there was necessarily a lot of growth in the existing health plans networks. Obviously, new plans come in, they had to institute contracts with a lot of providers to get up to strength, ready to go live and start accepting members. Providers come in and out of the program constantly. I mean, areas that the MCOs are always looking to bulk up are particular specialists that are difficult to find, and dentists. I know they're working on dental issues and certain other provider specialties, neurologists and dermatologists and things like that are always hard to access for everybody in the healthcare continuum. So I wouldn't say that there's going to be a lot more options, but now you'll have more plan options statewide. So you'll have plans now that are statewide, and because of their networks being statewide, you then have the ability to use any provider that's in that plan's network, even if it's outside of your zone. So that gives you some more options.
Great. Can we pause on the last piece there? I think we have encountered historically some difficulty for, say, an Amira Health Caritas member to use providers who are clearly in Keystone First network. Are those sort of rules regarding the ability of managed care plans to direct provider networks to be zone specific? Are those rules changing, or is the expectation changing on the MCS?
No, the rule hasn't changed. The expectation hasn't changed. Caritas and Keystone tend to contract differently because there's different ownership elements of those two products under that H license. Most of our MCOs don't have a problem with utilization of the providers outside that are in their network that are outside of the zone. But again, it's something, if you need to use a provider that's outside of the zone, that's in the network, it's always a good thing to approach the MCO to identify those. You can certainly go to their website and do a network search and see where this provider is, and then say, well, I'd really like to use this. Say I live in Lehigh Capital, but I have a special interest that I want to use this provider that they have in Pittsburgh. It would be a good thing to contact the MCO to explain that situation, because then they could actually facilitate perhaps the appointment and things, or they could tell you if there is a contractual difference. I would say most of the issues we see with that are between Amira Health and Keystone, because there are some contractual differences.
Right, great. The next two questions I'm going to read together. They both have to do with prescription access. Kyle, I think I'll boot this to you, and maybe we can defer to DHS for further elaboration. So the first question is, how is prescription coverage going to change under MA and the new insurance plan in regard to copays, pharmacies that accept the plan, et cetera? I know you touched on that a little already. The second part of the question is confirming that consumers in a new plan who had been going to the pharmacy regularly, like monthly, to access prescriptions like inhalers, can still expect to get those same prescriptions from the same pharmacy, right? What should a consumer do if they show up at the pharmacy and that pharmacist denies the consumer's prescription request?
There's a fair amount to unpack there. I guess working backwards, if somebody has a denial at the pharmacy, so once the plan change takes effect, I think they should ask for emergency supply. So there are provisions tied to the plans, even apart from continuity or changing plans. This is a supply they've been getting. I think there's an entitlement to at least a 15-day supply under that protection, right? This is something that was provided previously. But as to whether they can continue using that pharmacy indefinitely, the question is whether that pharmacy is in network with their new managed care plan. If the pharmacy is not in network, then there shouldn't be any issue during that initial continuity window. But there could be after that. Stepping back a bit to the earlier question, there was a note, are the prescription drug sort of the benefit package changing? And that's not, right? So going back to the plans are using the same preferred drug list. that piece should be the same. The drugs covered should be the same. There could be slight differences in the copay amount. So this goes back to, we have a standard benefit package. There are cost sharing protections that apply across all of the managed care plans. And so I think the fee for service rates for prescription drugs are, I believe, $1 copays for adults, $1 copays for generic, $3 for brand name. And the managed care plans can charge up to that, but many of them waive some of those copays, especially for generic medications. So someone could see a difference of, say, having paid a $0 copay or not paid any copay, and now have a $1 copay for a generic medication moving forward. And the chart that explains the copay amounts also on Laura and Teresa's handy website, Enrollment Services. So you should be able to pull that up, the comparison chart, and see which plans are charging for pharmacy coverage for adults.
So I will say this, there's potential, there could be potentially maybe some smaller independent pharmacies that may not choose to contract with all the MCOs, but Pennsylvania Health Choices program is an any willing provider program for pharmacy. And because of that, most of the pharmacies, the largest percentage of the pharmacies take the Medicaid MCOs and are generally in all the MCOs because it's, it's a good thing for their business. So there's a real good chance, depending on which pharmacy you're utilizing, that it would be in the new MCO. But again, always a good thing to check. You can probably contact the pharmacy, even you might not even need to go, you wouldn't necessarily need to look it up with your MCO. You could contact the pharmacy and they should be able to tell you which MCOs they are contracted with and do business with. And if the pharmaceutical is the biggest interest of your healthcare needs or whatever, and you maybe want to base a decision on that, you can do that. But we do have a lot of penetration in terms of pharmacies in the program that are participating with all the MCOs. Mm-hmm.
Thank you both. The next question will veer a little bit into PHE subject. I will ask this question of either Jesse or Kyle, either one of you could take it. Do all plans have to continue with current authorization of services for a child because of the public health emergency still being in place? If the public health emergency expires, do the plans have to continue 60 days after that time?
Jesse, do you mind if I start? So I think the question is referring to the pediatric shift nursing protections in place currently. And just to be clear, the public health emergency related protections in place tied to Medicaid services are tied just to shift nursing at this point. So the state had suspended prior authorization for a broader range of services, but those were that was lifted some time ago. I want to say last summer. So currently, the only service-related protection in place, and this is different than your Medicaid coverage writ large, right? The continuous coverage protections, but the service-related freeze is just pediatric shift nursing. So someone who already is authorized shift nursing can't have that reduced right now, right? So a new request could be denied. But that authority is being lifted. So the Office of Medical Assistance Programs has issued a bulletin on this. There has been public notice. It's being lifted November 1st. So the 60 days piece does not apply to that. Existing authorizations are supposed to be honored through and past November 1st. But beyond that, the managed care plans can, when they're doing their assessments, their prior auth reviews, they can reduce or deny services. Now, if they do that, they're required to issue the standard notices for the appeal rates.
Okay, thank you, Kyle.
Hopefully that answered the question.
I think so. Will patients be auto-assigned to healthcare providers that are not participating with that Medicaid plan? I think this is a DHS question. This goes to the auto assignment of a primary care physician if one isn't selected.
No, DHS auto assigns folks who don't make a proactive selection of an MCO. So DHS assigns an MCO to folks. Once they land in that MCO, the MCO then would make a selection of a PCP for their membership. That's based on a variety of algorithms. They look at where folks live and various PCP offices that are available that are taking new patients and things like that. So if you find yourself in an MCO, you really should outreach to them and select a PCP if you have something in mind, or if you want to discuss multiple MCO, maybe you want to talk to them about what PCPs are available in my area and do you have a recommendation? They can also help you on that as well. So it's a good thing to contact the MCO. But if you do not, they will assign a PCP, and then they would mail you a member ID card with the PCP identified on it.
And to be clear, Barry, the PCP that would be assigned would be an in-network provider with the new plan.
Yeah, I'm sorry, I missed that point. Yeah, an MCO, neither an MCO nor the department, whatever, assigns somebody a PCP that's like not in network with the MCO that they're in.
Okay.
So it would be a PCP that's in the network of the MCO which they've been assigned.
Okay, thank you. I think this may be another question for DHS. Do any or all of these insurance plans accept prescriptions by physician's assistants and certified registered nurse practitioners, or will they have to be signed by a participating physician?
I think that's under the nurse practitioner and physician assistant licensure. They can write prescriptions because they're by their very nature, they're under the supervision of a physician. So that applies to wherever they practice in the Pennsylvania healthcare continuum. So yes, nurse practitioners' prescription abilities remain in Health Choices as they would in other forms of insurance coverage.
Great, thank you. I think Laura or Terry from Enrollment Services, this can go to you. For those that don't pick a plan and are auto-assigned into a plan, how long will it be until their providers can see in the portal what plan was chosen?
Yeah, I wasn't sure I really understood that question. Are they talking about like the EVS system?
I think they might be referencing EVS, Laura.
That's what I was thinking. So I'll pass that one to Barry.
Yeah, the EVS is updated at the same time that the same systems in DHS that make the assignment to MCOs. So say come active September 1st, first day this is implemented. If folks end up going to their provider on September 3rd or whatever, yes, the information would be available in the EVS system for the provider to look in there and say, oh, I see you have United now, or you have Geisinger now, or whatever. So yeah, that should be available to the provider by September 1st.
Okay. This is a question for Enrollment Services, I believe, potentially maybe DHS as well, but when I go to enroll, it asks for a 9-digit recipient ID number. Where do I find the ID number?
Okay, that's a good question. So that should be on their access card, their access or their EBT card.
Great. And maybe Barry, you could answer this. If somebody happens to have lost that access card, how might they find out what their recipient ID number is?
I know when someone calls Enrollment Services, we refer them to the Customer Service Center.
Okay.
And I believe Jesse may have provided that number previously.
Yeah, that could be a resource depending on what kind of access they have to their caseworker at the CAO who determine their eligibility. They can ID their recipient ID number. And actually their MCO should be able to provide it as well. They could contact their MCO, and then once they're identified as the MCO's member and that sort of thing, they could provide them. The MCO has access to the RID.
Thank you. And sorry about my dog in the background. We'll try to get through this without her continuing to bark. There we go. Jesse or Kyle, can you see the questions to read a few more out loud right now?
Can I just add one thing? So I just saw a follow-up question in the Q&A. So the individual is saying they have a 10-digit number, so you just have to drop that last digit and just enter the 9 digits and remove that last one. Thank you.
Thank you, Laura, and thanks for bearing with me. My dog's now under control. A follow-up about the CRNP and PA signature on prescriptions. Fee-for-service Medicaid still does not accept those signatures on prescriptions, nor do the 3 CHC carriers. Will these physical health plans accept a CRNP or a PA signature?
I'm going to have to go back and look into that. I think from a licensure perspective, they are allowed to write prescriptions, but Medicaid may actually have a regulatory stance on that matter. So tell you what, why don't we take that back and maybe issue a response to you folks that you can then push out with, you know, the materials from the meeting.
Sure. So the person who asked that question, if you want to email me, I will be able to get the answer to you. My email's on the registration flyer that you filled out, and it's also on the registration page. It's dcasserly@phlp.org. It's DCASS as in sailboat, ERLY@phlp.org. So we'll get that answer for you. This is a follow-up question. I will shoot this to either Lori or Barry. A follow-up question for out-of-state coverage. Do the plans cover emergency medical services out of state?
Yes, they do. The plans cover emergency services wherever you are. So it's not uncommon for folks, obviously, children under Medicaid eligibility sometimes go to college in another state, or folks take their family vacation in August. Maybe they go out of state somewhere and they encounter an emergency. So all those sort of emergency situations are indeed covered. Sometimes you may need to work it out with the provider and the MCO, but those needs are covered. The MCOs can pay out of state providers for those types of situations. It's not a problem for them to pay them. So yes, that is a covered benefit. The benefit itself didn't change. You know, you can have emergency services performed here if you're on vacation, as long as your eligibility remains open. You haven't moved out of state or something like that. But if you just have to be traveling out of state and you have those needs, yes, that's covered.
Laura or Terry, I'll direct this to you. This person says, I'm working to get enrolled, use the ID number, and it is stating failed. Same when I use the social security number. What should my next steps be? Can call the hotline/customer service number?
Oh, I was just going to say, if the person is eligible for medical assistance and they're on the enrollnow.net website and they're having difficulty authenticating or pulling up their account, then I would definitely recommend calling us at our toll-free number, the 1-800-440-3989.
What would happen if someone in Community Health Choices, say, is trying to enroll in your website?
They will receive an error message as well, and that does happen. If they call us, then we will provide them with that toll-free number.
Just jump in also to say it can be a little bit picky sometimes, especially for folks who have multiple last names. You might want to try a couple of different ways to enter that. I know when we've been helping folks, we've seen that issue.
Great. The next question I want to ask Lori, you sort of touched on this in the beginning, but perhaps not everyone was here to get the answer. So what is the reason for the change of plans at this time?
The reason for the change is DHS issued a request for application, which is a bid for managed care plans to provide physical health services to the medical assistance population. Those bids were reviewed and the outcome of those bids are the plans that have been chosen to be effective with us September 1st.
Thank you, Lori.
I did see another question in the chat somewhat related to this that I don't think we covered. Someone asked, is this done yearly? The answer to that is no. These agreements will be in place for 8 years.
Great, thank you. That was going to be one of my next questions. The next question comes from a provider. I think I will shoot this over to DHS. I have a client whose nursing authorization is through Aetna, and that authorization ends on September 30th. Should I send the request for reauthorization early, or should I wait until the switch happens?
Well, I would say the request for reauthorization to whatever MCO this recipient chooses or is selected or is placed into, it probably better to contact that plan earlier, but after September 1st, they wouldn't have any of the membership information prior to September, well, about 5 days before September 1st, but they won't actually be speaking about authorizations and things until that person becomes their member. So generally, because of the authorization for those types of services tend to be technical and often involves discussions between an MCO medical director and the provider, probably better to start that process earlier on. So I would say contact the gaining MCO earlier in September.
Okay. This question I will boot to Jesse at PHAN. Will the medical assistance transportation program be affected by these changes?
Laurie or Barry can correct me if I'm wrong, but no, the plans, as long as you are already enrolled in the MATP program, that should continue without any changes. And if you do need to enroll new as a member for the MATP program, the medical assistance transportation, then you can always reach out to us for help with signing up to get for future use.
Yeah, that's correct. These changes don't have any effect on the medical assistance transportation program.
Okay. A question for Enrollment Services. Can consumers call Enrollment Services this weekend, the 13th and 14th, for phone assistance with enrollment? And if so, what are the hours? And can you remind us of the weekday hours? How late can consumers call on August 16th? Or is it until August 15th at midnight? That's a good question.
I know. So we do not have weekend hours. So the call center is Monday through Friday, 8 a.m. to 6 p.m. And yes, please call on the 16th. They can still call us to make their plan change, and we will be available until 6 p.m. And I just want to remind everyone to use the website or the mobile app. We are seeing a lot of activity. About 30% of the plan transfers are coming through our website, and about 9% coming through the mobile app. So we are seeing an increase in the online activity.
Okay. And just to be clear, people can still call on the 16th. That's the last day.
That is the cutoff. Yes, that's correct.
Okay, thank you. And this is the last question that I'm seeing.
Wait.
Oh, go ahead. Sorry.
So I was just going to add cutoff date for routine enrollments to take effect 9/1, but I would just flag the process that was described earlier. Someone with any sort of clinical emergency, if they miss the 16th, they should point that out to Enrollment Services, and they can request an expedited plan enrollment.
Okay.
This is Lori. I have a question for Laura. I know 6 p.m. is the deadline on the 16th for calls, but what is the deadline if people are enrolling through the web or the mobile app? Like what time of day? Is it the same?
No, that's a really great point, because we will be running jobs and everything to send the files over. So I would say up until 8 p.m. if someone's using a digital technology to make their plan transfer.
Great. And the last question that I'm seeing here in the Q&A panel is, I think maybe directed towards DHS. Do the physical health MCOs or health plans have to honor a patient's choice of servicing provider?
I'm not sure the context of that question, unfortunately. So the MCOs allow their members to select the providers that are within their network. And if you need to have a provider that's outside of the network, that's something you can actually approach them on, because there may be situations where the MCO might agree that somebody needs to have a provider that's outside of their network. Sometimes you see it with certain very special conditions where somebody needs to see a specialist that's outside of the network, and the MCO agrees with that. So to a certain extent, they will honor your selection of any of the providers that are in their network. For the continuity period that Kyle spoke of, folks who are in a course of treatment or have a prior authorization for a service, they will cover that with their selected provider for the periods that Kyle spoke about. So if you're an adult, it's a 60-day period. If you're a child, it's through the end of the authorization for whatever that service. They will honor that with the provider that's providing that. And again, and this is something that folks probably need to know, you'll need to speak with your provider about that, because the provider has to agree to conducting business with that gaining MCO. We have no control over providers. DHS has no ability to mandate a providers accept those continuity agreements. So it'd probably be good if you're in one of those situations to approach your provider and get a firm understanding of what their position on it is, and then discuss the matter with them.
Thank you, Barry. And we had a note in the Q&A box. It says no one answered my question. Ruth, I've unmuted.
Sorry about that. Thank you.
Okay. I'm sorry I missed it. Go ahead and ask your question.
That's okay. So we are a very small home health agency in the Lehigh Capital region, and many of our members are in UHC and Aetna. So we're looking forward to moving forward. I have reached out to the newer plans to our area, UPMC and Geisinger, and to enroll my agency so that they're, we can continue to take care of our patients. Does anybody have an in? It's been like 4 weeks. I can't get a hold of anybody. There's just like no number. I'd love to speak to somebody just to make sure, like I said, we take care of fragile pediatric patients. We're private duty shift nurses with ped, trach, and vent patients. So it is imperative that we, are able to enroll our patients so that they get taken care of.
Thank you, Ruth. That's very interesting. Yeah, they should be getting back to you, particularly for that service type, which the MCOs are always looking to expand the network. If you want to, I don't know if there's a means that maybe Dana, you could have her information transferred to me. Name of your organization, a contact, the appropriate person for the contact, and if you could identify which MCOs particularly you'd like to have contact you, I will ensure that happens.
Great, thank you so much, Barry. I just,
Sure.
It was just we love our kids. We want them to be well cared for, and we do our best.
Yeah, I mean, sometimes as we're going through a big implementation with this, particularly with plans who are expanding, their provider services people are so consumed with the nuts and bolts of contracting that they may not be as good at getting back to providers who are making outreaches and inquiries. So I will make sure that your inquiry goes through the government affairs folks, who will then have somebody outreach to you, because yours is a provider type that generally all the MCOs are looking for. Mm-hmm.
And I did have another quick follow-up question that occurred. My staff member walked into my office. One of my patients lives in Chester County, and we're in Lancaster County.
Okay.
And she picked Keystone. Can they still contract with us even though we're not in that zone for that patient? Is that something that's a reasonable thought process?
So I'm sorry, your patient is in Chester County?
Yes, our patient's
Correct.
in Chester County, and chose Keystone, which is not a capital Lehigh plan.
Well, let me ask you this. Do you contract in any way with Amira Health Caritas, which is actually, that's a related party?
Yeah.
So, yeah, If you want to actually send me sort of some specifics on that situation, I can have the Caritas people and the Keystone people respond to you on that issue as well.
Beautiful.
What I'll do is pull Ruth's email from the registration list and I'll get it over to you, Barry, so you can be in
Sure.
touch with her, okay?
Thank
Yeah,
you
that
guys so much.
Yeah, that'd be fine.
Okay, great. Thank you for that. And that's all the questions we have, and we are exactly at 3:30. So I want to thank all of our panelists for their time today. It was a very informative session. I hope everybody that joined found it to be informative and helpful. And any follow-up questions, please do reach out to PA Enrollment Services. When I circulate the slides after the session, you'll have all the phone numbers there that you need. All right. Have a great afternoon, everyone. Thank you again for joining.
Thank you.
Thank you.
Thank
Thank
you.
you.
Thanks, Dana. Take care.